As we continue to study the skeletal system, we will look at the bones of the skeleton. You were given, or in this folder for this week, skeletal system, there are practice sheets that you can, obviously, they're pointing out the bones that you need to know, and you can practice with that. We will talk about some of those and a few other ones today. There are 206 bones in the skeleton, and like I said, you were to learn about 30. The axial skeleton is the main part. It would be the skull, the vertebral column, and the rib cage, sort of the bones within the trunk. And then we have the appendicular skeleton, which are the arms and the legs. And then their attachments, which would be the shoulder and pelvic girdles, how they attach to the axial skeleton. Ligaments are also a part of the skeletal system. They connect bones to bones and keep the bones in proper condition. And these ligaments are made of fibrous connective tissue. Here is the skeleton with the bones pointing out the ones that you are to know. We will discuss all the bones, and hopefully you could have your page of your skeleton beside you so you can kind of look at these things as we talk. There are 8 bones of the skull and 14 bones, the 8 cranial bones in the skull, those that surround the brain, and then there are 14 facial bones. There are also the little bones of the ear, the incus, the malleus, and the stapes, and you don't need to know those, and the hyoid that supports the base at the tongue of the tongue, and that's the one that we often hear about when people are strangled, that gets squished. The cranial bones, they enclose and protect the brain, the eyes, and the ears. All joints are immobile sutures. We'll talk a little bit more about joints in the next presentation. But all you need to know these as the cranial bones or the skull. I will point them out at this time, though. The frontal bone is at the forehead and the top of the brain towards the front. The parietal bones are the posterior, a little bit farther back on the skull, and then go towards the sides. The temporals are the lower sides. The external auditory meatus opens through this, and then the occipital bone is the lower posterior portion. The foramen magnum, that's the large opening there for the spinal cord, and then it has 2 condyles that articulate or form a joint with the first cervical vertebrae called the atlas, and we will talk about that a little bit more when we talk about the spine. The sphenoid is the base of the brain, so that's kind of underneath behind the eyes, and the ethmoid is the roof of the nasal cavities and the upper nasal septum. As I said, we're not really looking for you to identify these individually, although the more you learn, the better. The bones of the face. The mandible is your lower jaw, and it forms a joint, a condyloid joint, which we'll talk about what kind that is, with the temporal bone, because our jawbone moves up and down and a little bit from side to side. And the tooth sockets, where the roots of the tooth are actually considered a joint as well. The maxilla is the upper jaw, and here again we've got tooth root sockets in there. And then the anterior portion, that's the upper back part, is the hard palate, the top of the mouth. The nasal bones are those that we call the bridge of the nose. They articulate with the frontal bones. The lacrimal bones on the medial side of the orbits of the eyes. And there's a canal there so that tears can pass through. And then the zygomatic bones, that's the point of the cheeks, the ones that usually stick out. These happen to articulate with the maxilla, the frontal, and the temporal bone. And we see these are all sutures. Those are immobile joints. Continuing with bones of the face, the palatine bones are the posterior part of the hard palate, so the top of the mouth. The vomer is the lower part of the nasal septum. And the conchae are the nasal cavities. They're scroll-like bones. There are 6 of them, and they make a passageway so that air can have more time to get warmed and moistened as it goes through there. And then we talked about the auditory bones, malleus, incus, and stapes. And these transmit the vibrations from the eardrum to the inner ear. But we're not pointing those out at this point. The sinuses are air cavities. They make the skull lighter, and they also let our voice, the air bounce back and forth to make the sounds. The paranasal are the maxillary, frontal, sphenoid, and ethmoid. These open to the nasal cavities, and they're lined with ciliated epithelium. And these sometimes get infections if we have some upper respiratory infections. The germs can get in there and grow and reproduce. And then we've got the mastoid sinuses, which are in the mastoid process of each temporal bone, and these open to the middle ear. These are pointing this out, but this is anything we're really going to study as far as this particular course. But these are made of bones, and these air spaces are created by the bone structure. The vertebral column, there are 7 cervical vertebrae. Those are the ones in the neck. The top one is called the atlas, and we said that that articulated with the occipital bone and forms a pivot joint so that we can turn our head from left to right as it articulates with the second cervical vertebrae called the called the axis. So the atlas is the top one that holds the skull, and that's how Atlas, I think, the god that holds the world or something like that. And then that atlas forms a pivot joint with the axis, the second bone down, so that the head can turn. It is a pivot joint. Then we have the 12 thoracics that, here again, some of them articulate with the ribs. We've got 5 lumbar. These are the longest and strongest. Then at the bottom of the vertebral column, we have the sacrum, which are actually 5 fused bones. And this is where the hip bone articulates. And then we have the coccyx, which are either 4 or 5 coccygeal vertebrae, here again, that are fused together. And this anchors the muscles of the perineum. All vertebrae articulate with one another in sequence. So that means those are all small joints. They're slightly mobile joints because we can twist a little bit, we can bend a little bit, and our movement comes from the action of more than one joint. The vertebral canal is the opening down through the center of all these vertebrae, and that's where the spinal cord is, the lower part of the central nervous system. They have spinous and transverse processes. These are little projections off of it to which muscles attach. Some of the vertebrae have facets, and these are flat surfaces that other bones can articulate to, just as we talked about the sacrum articulates with the hip bone. And in between each of these vertebrae, there are discs. These are a little fibrous cartilage. And here again, like that gives us that little bit of motion. It gives us that flexibility. They may become broken, if you want to call it that. We use the word herniated, we might use ruptured, we might use the word slipped. And what that does is the little spinal nerves that come out between every one of these, if this disc isn't nice, it's nice big shape holding these bones apart, the bones squish down on one another, and that makes pressure on these nerves, which can be painful and which can actually squish the nerve to make loss of function. If it's in the cervicals, maybe you can't pick up things as easily. It's in the lumbar vertebrae. Walking can be difficult. There are normal curves in the vertebrae. There are 4 of them. If we look from the side, and we're going to look at a picture of that in a minute, but the cervical curve forward, the thoracic curve backward. Those are the ones of the, if you would call it the chest. The lumbar, the lower back, curves forward, and then the sacral curves backward to finish out the end of the spinal column. There can be abnormal curvature. The first one is different, and it's a left to right curvature. So it's lateral. And here again, this can be congenital. There can be sort of bone misformations or poor posture. And this can, even though you think, well, I don't know, it's just holding up that spine, but it can cause, because it's not keeping the skeleton, and we said the skeleton gives the body shape, in good order, it can cause some problems. And then the other 2 are just exaggerations of the normal curves. Kyphosis is the exaggerated backward curve of the thoracic, the hunchback. Here we can see this in cases of osteoporosis, or sometimes here again it can be congenital. Lordosis is the exaggerated forward curve of the lumbar spine, the sway back, so it's kind of like the body's tipped up. Sometimes this can be a temporary situation in pregnancy to kind of help balance the body. So here we look at these. The cervical vertebrae, numbers 1, the atlas holding the skull. Number 2, the axis. So the joint between 1 and 2, atlas and axis, is the pivot that we can turn the head. And then we see the cervical with a little forward curve, the thoracic with the backward curve, the lumbar down here with their forward curve, and the sacral with the backward curve. So those are the normal curves. And then certainly points out the vertebral bodies, facets, and then the spinous processes we talked about, and transverse processes. We see them put labeled there on that 7th lumbar vertebrae.